I am Dr. Eric Jones, and I am a pediatric hospitalist. I completed my undergraduate degree at Brigham Young University in mathematics. Then I went to medical school at the University of South Dakota, and I completed my pediatric residency at Nationwide Children's Hospital in Columbus, Ohio. I started my pediatric residency 3 years ago at Nationwide Children's Hospital. I got experience in outpatient and clinic work, as well as inpatient work in a lot of different specialties. And then I also did some experience at Ohio State University in the NICU and in the newborn nursery. If I could change one thing about patient care, I think I would want things to be more personal and for doctors to have the time to talk with patients and really understand what their concerns are, and also to have an opportunity to address those concerns and make people feel like we're listening to them. I remember one patient that I cared for on the cancer floor. He was a teenager and he was really sick. He was in a lot of pain, but he was one of the most respectful people or children or adolescents that I've ever dealt with. And I think seeing him work through all of the pain and the challenges that he was in helped me to put all of my problems in perspective and helped me to really see him as a person. And I think that helped me when I am caring for patients to look at each person individually, to recognize that they're going through something really difficult, and also to make sure I'm doing my best for each patient that I care for. I like taking care of children because they're just lively and they're fun, and when they're feeling well, they feel well, and when they're feeling sick, they don't, and then when we make them feel better, they're back to feeling well and being kids again. I like to describe my bedside manner as warm and friendly. I like to keep the conversation going. I like to think that I'm not necessarily using big words all the time and trying to sound smart, but I think that I like to just connect with people on whatever level they're at. I think that getting to know patients and families on a personal level is the most important thing that we can do for people, because if I don't know the patient and their family on a personal level, then they're probably not going to listen to me or do what I ask them to do. And so I think that's step number one, is just getting to know people on a personal level. As a pediatric hospitalist, I take care of patients from newborn all the way through 18 years of age. So I start out in the newborn nursery. I take care of infants, doing an exam to make sure everything's okay. I'll take care of babies that have a difficult delivery and need extra resuscitation. I'll take care of infants with high bilirubin levels and jaundice, infections, and then in older children, we'll take care of skin infections, lung infections, and also mental health is becoming more of an issue. And so oftentimes I'll make sure that children are healthy enough so that they can receive the mental health treatment that they need if they're admitted to the hospital for that. So the procedure that I perform most often is a circumcision. I also will need to be proficient in intubation, or putting breathing tubes into patients, particularly in newborns that are having problems. Also, sometimes we need to put a chest tube in, or a tube into the chest if a newborn has air around the lungs that shouldn't be there. I chose my specialty in medical school. It took me a couple years to realize what I liked. I think most doctors, when they're in medical school, find a few things that they don't like, and so it's easy to check those things off, but there were still a lot of things that I liked, and there's still a lot of things that I do like about medicine. So I knew that I wanted to do something that I would see a big, broad range and a big spectrum of different types of patients. And so I think general pediatrics allows me to see that, from newborns all the way up to teenagers when they're 18 and they're almost an adult, and I'm dealing with lots of different problems. I think the main reason that I want to be a pediatrician is when I was in college, I had my first child, and the pediatrician that was taking care of him came to see him when he was in the hospital, and he wasn't on call there. He really didn't need to come, and I think he made the effort just to come see my child, and that made such a difference to me because it was a scary experience to have my own child in the hospital, and seeing somebody that I knew and recognized really helped me to feel more comfortable and confident. And so I wanted to be able to provide that reassurance and that comfort to other parents when they're worried about their children. So technology in medicine, I like to think, is a really positive thing. I think the technology that we have now, number one, it makes patient information readily available to all the doctors that are taking care of that person. So from the emergency room where you first see the patient to then the inpatient side, we can look at x-rays, bring in CT scans and MRI scans from other hospitals, and also look at lab results from outside agencies and outside clinics. We can also look at notes from other hospitals and other clinics. And I think that just having all of that knowledge readily available makes it a lot easier to care for the patient and make sure we're taking their whole story into account. My favorite thing to do after a long day is to go home and spend time with my family. I have a wife and 4 kids, and I like to cook. My wife likes to bake, and so lots of times we'll make dinner together. I hope that the care that I give people and what I do makes them think of me as their doctor, but I also just want to be just Eric and somebody they can talk to and feel comfortable sharing their concerns with and just listening and taking care of them.